Hello and welcome to our webinar about writing the present level of academic and functional performance. This is part of a Writing Great IEPs webinar series put on by ESU 13 Special Education Planning Team. Your presenters today are myself, Jessica Broderick, and Kinda Foos. The material that we are using for today's presentation is a collaborative effort between Nebraska Department of Education, the Office of Special Education's IEP Facilitation Cadre, and then the members of our special education planning team provided knowledge and expertise to develop this content. I am Jessica Broderick. I'm the Assistant Director of Special Education at ESU 13 in Scottsbluff.
And I'm Kinda Foos. I'm the Meridian Lead Teacher at ESU 13 in Scottsbluff.
What we want to share with you today is just to have you identify what information should be included in present level statements, and then to identify the connection between the present level and your goals in the IEP. So here's one of our biggest takeaways is that the present level kind of outlines everything else that's in your IEP. So having a strong, thorough present level is very important. This is where you will determine the need for your goals, your services, and your modifications and accommodations. So the more information, the more data, the more you can include in this section, the better. So here's just some characteristics of strong present level statements. So present level statements are performance-based and really speak directly about a student's performance. They're objective and not subjective, so it's not your opinion of how something is going, but you can put in factual statements and back them up with data. Present level should explain how the student's disability affects his or her involvement and progress in the general education curriculum, which is part of kind of how that outlines why they need additional supports or help in different areas. We want to show how that is affecting them accessing their regular education. This is what will serve as our standard for judging progress. So you should have information about where the student is at this very moment. And so when you look at the present level or information for next year, you have a good baseline of where the student is from year to year. Good present levels should be well-rounded and have data from multiple sources. So you should definitely be accessing the general education teachers, maybe some specials teachers, the after-school programs, paraprofessionals, whoever is working with that student to gather information and data from multiple sources. Strong present levels contain data, and I underlined that and put some exclamation points after it because that is really important. You should have, like I said earlier, numbers in there, objective statements about how they're doing and how you know, percentages, frequencies, so many out of so many trials, those kinds of things. Present level statements will drive the creation of goals. So if you have outlined a need in your present level or an area that a student is struggling or needs help with skills, that will then tell you what areas the student might need goals in on their IEP. And then parent friendly. So I know we can get caught up in our special education lingo sometimes, but always making sure that we have removed acronyms or abbreviations when possible, or if there's a reference to maybe a district-wide assessment, to always give an explanation of what that is or where that comes from, so any parent can feel comfortable reading about their student's current level of performance. Places you might get present level information, you might give your teachers a questionnaire. So you might survey the teachers of that student to gather information. You want to look at your classroom data collection. So that might be data you're collecting as a special education professional, or classroom data that your general education teachers have. Related service providers are a great source of information for this. Any office referrals, behavior referrals, and attendance, from your student information system, information from a behavior plan, that can all go into present level. Your school counselor has a lot of great information too. especially for transition age students, because those students are usually working with that school counselor to talk about post-secondary education or plans after graduating. If it's a transition age student, you might also have information from transition assessments that you've done that could be included here. You might do a questionnaire with a parent or just an informal phone call with a parent to gather their perception of how things are going and include that information. And then if it's a student with health concerns, you might also have information from your school nurse, maybe something about their health care plan or their health status. Kinda's going to give us some examples of information to include.
Okay, a statement about academic performance and how it affects progress in the general education. An example of this would be Jessica knows her multiplication facts to 5 and has mastered half of the 6's multiplication facts. When compared to grade level peers, Jessica should be able to access mental multiplication facts to 12 in order to complete multiplication and division story problems. An example of statements on functional performance and how it affects independence would be due to her physical limitations, Jessica requires the support of a one-on-one paraprofessional in the restroom to transfer her from her wheelchair to toilet. She is able to clean herself after using the restroom, then needs support to transfer her back to the wheelchair. Information to include also includes measure state of previous IEP goals. An example of this is in the 2019-2020 IEP, Jessica had a goal to read 130 words per minute with 5 or fewer errors. At the time of this IEP, Jessica can read 130 words per minute, but makes 8 to 10 errors on average. Health status. We want to include, does the student have a health plan on file with the school nurse? Are there medical or health concerns, i.e. seizures, asthma, diabetes? An example of this would be, Jessica currently has an individual health plan with the school nurse for seizure management. She takes medication daily at home in the morning and evening, and the school nurse has emergency nose spray in his office. A statement about physical education. An example, Jessica's disability does not affect her participation in regular PE classes with her peers. Example, due to Jessica's physical limitation, she participates in an alternative physical education course at the direction of her physical therapist and with the support of a paraprofessional. Transition IEPs may also include vocational skills, independent living skills, community involvement access, and interagency linkages. Not only areas of difficulty or need, include all information from classes or times of day. Include comments on students' behavior or performance, and they should be measurable and observable. Example, Jessica's attendance has been variable so far this year. According to Infinite Campus, she missed 5 school days and has 7 tardies. A second example, during social studies class, Jessica is noted to struggle more with behavior than throughout the rest of the day. When given guided notes, Jessica has been observed to tear up and throw those notes in trash 5 times during the second quarter. She had 3 office referrals from this class for shouting at the teacher. You do not need to include information from the prior PLAP. It's a snapshot of the exact moment of this time. That's important. So you don't have to include back information. Examples, I'm going to do a comparison here. Maggie often misses classes. In comparison to that, you should say, according to attendance records, Maggie averages 3 unexcused absences per week. John struggles with reading, speed, and fluency. A better way of putting that would be based on Dibble's assessment. John can read an average of 30 words per minute with an average of 3 fluency errors. Let's do a poor example. Carrie's knowledge of math facts is lower than that of her peers. A better example of that would be on 1 minute mixed multiplication facts up to 5s, Carrie completes up to 15 problems with 70% accuracy.
Okay, so like I mentioned, the areas that you outline for need in your present level should have a connection to the goals that are in your IEP. So that present level is really the place to outline, we need to work on this, we need to work on that, or we need the services of this OT or this professional. And so any area you note that is a need in the present level should have a goal. And each goal should be documented in the present level. And so I have an example goal worksheet for you. I just wanted to show you this. This is something we use with teachers who need help with this, or just to, I think it's a very parent-friendly way to show that this is where we're at right now and this is presently what the student is doing. And here's what we need to write a goal about. So this will be linked below the video in the comments. But you could note here that the area of need is reading fluency, the present level of performance, what your baseline is, so that might be your 30 words per minute, and then a spot for your annual goal. And in this specific example, I have a SMART goal writing format laid out. So what's the specific skill, the measurement, is it achievable, is it relevant, and what is the time frame? If you're including objectives under that goal, any accommodations or modifications related to that area of need, and then what services will support that goal. So I think that's just a nice way to kind of tie together a lot of different areas of the IEP to really show the roadmap of what that looks like and why we're choosing to write the goals that we are. I also think that it's a very parent-friendly way to present that information. And that is all of the content we have for you today. Thank you for joining us. We appreciate your time and hope you found something helpful. If you want to receive professional development credit through ESU 13's Professional Learning Department, we would ask that you please fill out the Google form shown here, and that will be linked in the comments below. It has space for your information, ask what you've learned as a result of this, and then if you have any additional questions or need more clarification, there's a spot to indicate that, and then one of our team members will follow up with you. So thank you so much for joining us.